Hi, I'm Dr. Mushaka.
I'm Dr. Phillips.
And I'm Dr. Hugh, and today we're here to talk about Tourette syndrome.
Tourette syndrome is an inherited disorder of the nervous system involving uncontrollable movements and sounds, known as tics. The exact cause of TS is unknown, but scientists believe that MRI tests have shown that the structure of one's basal ganglia is different from normal patients. These abnormalities are believed to affect one's neurotransmitter levels, affecting one's reflexes and mood. Early signs of TS are detected in ages between 3 and 9. Although this is a chronic condition, the severity of symptoms is at most in early teenage years, but gradually improves as they turn to adults. The main symptoms of Tourette's are centered around the appearance of motor and vocal tics, ranging from mild to severe depending on the amount of interference in the brain. Motor tics may include jerking of the head or arms, twitching of the face, or blinking. Vocal tics may include yelling, coughing, grunting, and repetition of words of those around them. The appearance of tics may worsen depending on if an individual is experiencing anxiety, fatigue, or excitement. Those with TS experience a severe discomfort prior to a tic that can only be relieved once an action is done. Many individuals can suppress their symptoms for an extended period of time. However, it must be followed with an abrupt release of tics after a period of such control.
In addition to involuntary movement and vocalization, those with Tourette's may have neurobehavior disorders such as ADHD, OCD, depression, general anxiety, panic attacks, and mood swings. In contrast to tics, it is possible that these neurobehavior disorders may not diminish over time.
In order for an individual to be diagnosed with Tourette syndrome, they must have 2 or more motor tics, such as blinking, and 1 vocal tic, such as clearing the throat or yelling. Additionally, they must have had tics for at least a year, occurring every day, almost every day, or on and off. Another part of the diagnosis is that the tics began before the age of 18. And lastly, they must not be a result of medication or another medical disorder. While the exact cause of Tourette syndrome is still disputed, many scientists believe that it involves the basal ganglia. The nerve cells of the basal ganglia are responsible for managing body movement. The structural deformity characterized by TS causes complications in the transmission of nerve signals. This may be due to high levels of neurotransmitters such as dopamine and serotonin that cause complications in the communication between nerve cells. Although little is known about the development of Tourette syndrome, besides its relation to the basal ganglia, most scientists agree that it is probably due to genetic and environmental factors. Tourette syndrome cannot be cured and is a chronic condition. However, there are treatments available. The tics that occur often do not impair an individual's daily life, but medications do exist if they cause pain, injury, stress, or interfere with school and social life. There isn't a single best medication since different individuals react differently to medications, and additionally, no medication completely eliminates the effects of tics. Neuroleptics are often effective at suppressing tics, but they do have side effects such as weight gain, sedation, and cognitive dulling.
Behavioral therapy is another option to help suppress tics. One successful option is known as habit reversal. This is done in 2 parts: awareness training and competing response training. The first step is to identify the tic out loud. Next, they will practice a behavior that cannot occur at the same time as a tic carries out. A new therapy is called comprehensive behavioral intervention that is used for TS and other chronic illnesses. Habit reversal is also a part of this treatment, but additionally, education on tics and relaxation techniques are incorporated into this therapy. Therapists work with TS individuals as they attempt to identify the tic that is occurring and what situations it is worst at. Along with habit reversal, the surroundings of a TS patient are altered to suppress the expression of one's tic. CBIT skills are also taught to other individuals, such as teachers, so they can assist TS patients when a tic occurs. Lastly, Tourette tics can be reduced through activities that require repetitive movements and high concentration.
It is estimated that 1 out of every 360 children between the ages of 6 through 17 have Tourette syndrome, which is equal to about 138,000 children. Caucasians are twice as likely to be diagnosed with Tourette syndrome than blacks and Hispanics are, and males are 3 to 5 times as likely to be diagnosed with this disorder than females are. Children between the ages of 12 through 17 are twice as more likely to be diagnosed than children from the ages of 6 through 11. Additionally, 86% of all children with Tourette syndrome have at least one other developmental, behavioral, or health condition.
We understand that Tourette syndrome is very difficult to live with.
But there are plenty of resources available to help assist you with this disease.
If you suspect that you or your child has Tourette syndrome, contact your primary physician immediately, as they can help you start the road to a better life.